talk Juvaderm Voluma. My name is Eve. I am an advanced nurse practitioner prescriber based in the UK. Let's talk. Voluma is an injectable dermal filler that can help restore volume loss to the face. As we age, our face loses volume and starts to sag. This is the normal aging process caused by ligaments relaxing, fat pads shrinking and dropping, and bone reabsorption. It's normal. Treatment with an injectable treatment such as Juvaderm Voluma can help combat this. It can be injected into the midface, cheeks, jowl, chin to help restore the skin's internal structure and combat the volume loss caused by the normal aging process. Juvaderm Voluma is made up of hyaluronic acid. We naturally have hyaluronic acid in the middle layer of our skin, but as we age, this natural hyaluronic acid diminishes. Juvaderm Voluma is made up of an artificial hyaluronic acid, a chemical made in a laboratory, which is made so similar to our own natural DNA that our body thinks it should be there, minimising the risk of problems. So this takes us nicely on to what are the risks associated with Juvaderm Voluma. Well, as always with injectable treatments, your worst case risk scenario is that you have an anaphylactic reaction. This is very rare. The next risk is that you get what we call a vascular occlusion. Now, this happens when the injectable product, in this case the Voluma, is accidentally or incorrectly injected into one of the major blood vessels in your face. If this was to happen and the blood vessel was occluded with the dermal filler, it would stop the blood flow to a particular area in your face. If left untreated, this could cause permanent tissue damage, even tissue death, and sadly, if left untreated, this could also lead to blindness. Fortunately, the risk is minimal. A good injector will know their anatomy and physiology and know where to inject and where not to inject. Obviously, nobody's anatomy is textbook, and sometimes major vessels are in areas that we don't expect to find them. Now, if the dermal filler did end up in the wrong place, we, as a practitioner, would need to use an enzyme called hyalase to dissolve the dermal filler straight away and restore the natural blood flow to your face. Problems occur if your practitioner is not experienced enough to identify a vascular occlusion, or your practitioner does not know how to deal with a vascular occlusion. And this comes back to what I've said in several videos already. Choose your practitioner carefully. So moving on from the risks of vascular occlusion and anaphylaxis with Voluma, your next risk, and this is relatively common, is some bleeding, bruising, swelling, mild discomfort. Most of that settles very quickly. Occasionally you can be left with some lumps and bumps, but again, that's very rare and they do tend to resolve quite quickly. As with most injectable treatments, I always advise my patients to book their appointment when they don't have anything too important on for a few days. So if they do get any bruising or swelling, it's not going to be the end of the world. Thank you so much for watching. Please, if you have any questions, let me know in the comments, and I would really appreciate it if you could like, follow, and subscribe to my page. Thank you.